Chapter 52, Female Reproductive Disorders. So, the first one is uterine bleeding disorders. There's what we call metrorrhagia and menorrhagia. Metrorrhagia is the bleeding or spotting between menstrual periods, okay? Between menstrual periods. So, those female or those patients that actually bleeding or having those spotting even though they're not on their menstrual cycle, okay? Now, your menorrhagia is a menstrual period that is characterized by profuse or prolonged bleeding. Okay, profuse or prolonged bleeding. And in page 1015, the table 52.1, it's really helpful with showing us like what could be the causes of your metrorrhagia and your menorrhagia. So please highlight this table 52.1 in page 1015. Very helpful. Like for example, your metrorrhagia, there's a lot of causes or that could be causes of this condition. Is one is ovulation or even the contraceptive use, birth control use, some kind of ectopic pregnancy, vaginitis, and all of those things. And what would be the signs and symptoms if that's the cause of that bleeding disorder? And then what do we do? Medical treatment, okay? So please know this table. Very important for us to know, okay? All right, cause and risk factors of the metrorrhagia and menorrhagia, like I just mentioned, that is in this table. And it's also in this PowerPoint right here. Metrorrhagia is hormonal dysfunction, tumors, coagulation disorders, systemic diseases, contraceptives, endometrial hyperplasia, inflammatory process. Or menorrhagia could be pregnancy, weight gain or loss, physical activity, or stress, pituitary, hypothalamus, thyroid, adrenal disorders, ovarian failure, and uterine abnormalities. So, how do we diagnose uterine bleeding disorder? Well, we did talk about those diagnostic tests and procedure. We can do like a colposcopy. We can do some like imaging, like or ultrasounds, right? Some lab blood draws, hormone levels, right? Depending on the causes. And then we can even check for like what you call this, like tissue specimens when we do like those stains and cultures. Yeah, we can use that. And then in addition to that, we are going to, because this is a bleeding disorder, right? So we are going to check and make sure that the patient don't have the anemia, right? So we're going to check like your CBC, your complete blood count, which is going to show us what we call hemoglobin and hematocrit levels. So we have to make sure that we're checking those. For the treatment, well, it depends on the cause, right? So that's why we're gonna know the cause first. And then that's when we're gonna, devise the treatment or plan a treatment. So we can do some pharmacologic treatment, and can include like oral contraceptives or progestin, and then some causes could be actually treated by doing a surgery, and like, or we can do some kind of what we call endometrial ablation. This is an outpatient surgery that actually helps with stopping or controlling that bleeding disorder from the uterine. Nursing care is the same as the treatment. It depends on what is causing the uterine bleeding disorders. However, we have to be very vigilant with checking the hemoglobin and hematocrit to check that the patient is actually not developing those very bad anemia. We have to correct it right away. Vulvitis and vaginitis. So, vulvitis is the inflammation of the vulva, and vaginitis is the inflammation of the vagina. Okay, what are the common cause and risk factors? Common cause is the Candida albicans or the yeast infection, and the other one is like Trichomonas vaginalis, which is a protozoal infection. So depending on the causative agent, the vulvitis may be viewed as an infection as a local manifestation of a general skin disease or as a reaction to a chemical irritant or allergen, or just as a common consequence of the aging process itself. Signs and symptoms would be that there will be swelling and then redness and then itching. So if it's Candida albicans, it's actually the causative um, pathogens. There will be a cottage cheese like discharge, and there will be a foul odor. Okay, if it's caused by the yeast infection, your Candida albicans. And then your Trichomonas vaginalis is a protozoal infection. There will be a profuse, frothy, yellow-gray, fishy odor. And what will be a complication for the vulvitis and vaginitis? So even though it's out there, right? Vulva is in the outside, and then vaginitis is in the internal, but still in the kind of like the opening. So the complications that we're actually trying to prevent to happen is the ascending infections. It could go all the way up to the uterus, all the way up to the ovary, and everything else that is in the pelvic, right? So it could go all the way up to, or the infection could go all the way up to the pelvic cavity, which is very bad if it reached that part because it's more advanced. All right, medical diagnosis is the infection, right? You're gonna see that the vulva is actually um, infected or swollen or red. And then vaginitis also, you're gonna see it that there will be some kind of swelling and redness. And then we can also do specimen collection, like we said. Could be caused by the Candida albicans or the Trichomonas. So it really depends on what specimen is actually causing the infection. We can do a specimen collection. Medical treatment, like we said, is based on what is actually causing the infection. Okay, if it's bacteria, antibiotic. If it's you know what you call this the Candida albicans, right, some medications that we give for the yeast infection. Okay, all right, Bartholin gland. If you guys recall that Bartholin gland that I did point out when we were talking about the external slash internal genitalia structures, so it's those glands that's actually next to the vagina, and it's inflamed, right? There's an abscess. That's why it's called Bartholin gland abscess or Bartholinitis. So, what could be the causes and risk factors? Your Staphylococcus aureus, your Streptococcus, right, bacteria. You have your Trichomonas vaginalis, Neisseria gonorrhoeae, either chlamydia or Mycoplasma hominis. And most of the time, the reason is that this these pathogens right here are introduced through improper hygiene, right? For example, that patient is actually um, wiping maybe from back to front, right? Or maybe having a poor hygiene or improper hygiene in general, right? Not even washing, not even cleaning, so that those bacteria is actually invading the area. Okay, signs and symptoms of Bartholinitis. There will be a perennial pain, fever, there will be a labial edema, chills, malaise, and purulent drainage. Complications that we don't want to happen. Well, it's local, right? Because it's in the Bartholin gland. It starts there. However, it could also um, spread from local to actually systemic, right? And we don't want it to be systemic, okay? All right. Cervicitis, or the inflammation of the cervix. It could be acute or chronic. And what are the usual cause and risk factors? Well, this is an inflammation, so it could be caused by a variety of agents that are actually infectious organisms that can cause infection, a scraping of cells from like diagnostic testing, which one example is the dilation and curettage earlier on, cryosurgery, tampons could cause this, childbirth, neoplasia, decreased estrogen level, and menopause. So signs and symptoms may be asymptomatic. However, it may cause pain, visible vaginal discharge, bleeding, or even dysuria and swollen cervix. Okay, most of the time, those asymptomatic, we are going to um, see it when we do those diagnostic testing, like your pap smear, your pap tests. This is the one where the examiner is going to insert that speculum, and then they're gonna see that the cervix. Remember that picture that I said? This is how the this is what the examiner is going to see when they're looking at the cervix. So in there, they're going to see that the cervix is swollen and then red. Okay, there might be some kind of discharge that if the cervicitis is actually caused by sexually transmitted infections. Complications of cervicitis, one of them is your pelvic inflammatory disease, or your PID, where the structures in the pelvis are actually inflamed, which is not a good thing, right? It's a bad infection, so you don't want it to get to the PID, and the next thing you know, patient's gonna have some kind of sepsis, right? Medical diagnosis and treatment, pap tests. I did talk about the pap tests. And then some pelvic exam also. When they do the pelvic exam, of course, they're gonna see that the cervix is actually red and inflamed. That's cervicitis. And then for treatment, it depends on what is causing it. Again, if it's bacteria that's causing it, then we can order the patient antimicrobial, topical, or oral estrogen. Um, and why are we giving the oral estrogen? Because, like I said, one of the cause or risk factors for cervicitis is a decreased estrogen level after a menopause. So, part of the treatment could be a topical or oral estrogen, cauterization with silver nitrate, or even surgery if we have to. Nursing care, we just want to make sure that they're actually adhering to the treatment that we put in place. Again, if it's an antibiotic, if it's caused by bacteria, then we can order the antibiotic, antimicrobial, making sure that the patient is actually compliant. Mastitis is the inflammation of the breast tissue. Okay. This is most commonly occurring in the women that are breastfeeding, right? Most of the time, what are the causative pathogens and risk factors? Your Staphylococcus aureus, your E. coli, and streptococci. What are the signs and symptoms? Um, if it's confined to one breast, right? Then it only is one breast, okay? But what are the signs and symptoms? So we're gonna see that the breast is actually tender. There's like a localized pain, maybe even fever, tachycardia, general malaise, and headache. And this is painful, okay, and uncomfortable. So fibrocystic changes is when there's like an excess fibrous tissue or overgrowth of the lining of the mammary ducts. Therefore, there's like formation of some cysts. This is a response to a hormonal influence. The breast change um, is going to be like exaggerated in response to the hormonal influence, and that becomes a fibrocystic changes. So cause and risk factors more common among women who have never given birth: spontaneous abortion, early menarche, and late menopause or premenstrual abnormalities. What signs and symptoms of the fibrocystic changes? There will be painful lumps, milky yellow or green discharge. These symptoms are commonly most apparent during the premenstrual phase, like before the menstrual cycle, and typically improve after the menstrual period. Medical diagnosis and treatment. So we do physical examination, like we said, the BSE, very helpful. Mammogram if we really need to do those imaging. And then treatment is focused on the managing of the symptoms. So there's no specific cure for the fibrocystic change. However, these danazol, um, right here, danazol can actually help reduce symptoms by decreasing the estrogen productions. Vitamin E can help. Diuretics, a low salt diet, wearing a good support bra, and stress reduction, restriction of coffee and chocolate can also help. Nursing care, monitoring via self-examinations. Again, changes in the breast tissue. So that's why we want to make sure we're doing those BSEs, the breast self-examination, so that we can actually catch if there's any of these disorders, such as your fibrocystic changes. Pelvic inflammatory disease. So, what is pelvic inflammatory disease? This is an um, infectious process that may affect any or all structures in the pelvic portion of the reproductive tract and peritoneal cavity. Again, we did talk about this PID or pelvic inflammatory disease as one of the complications that could happen if we do not actually address those infections when it's still, mild, or it has not reached those upper structures yet. Signs and symptoms could be asymptomatic, or if there is symptoms, then the patient is going to have some low abdominal pain, chills and fever, even diarrhea, irregular bleeding, foul smelling discharge, vulvitis, and dyspareunia. Okay, common complications for PID, it includes ectopic pregnancy, infertility, and chronic abdominal discomfort. Medical diagnosis, we can do the physical examination. In cultures, sonography is really, really helpful because we're gonna check and see the inside structure of the pelvic cavity, right? Or we can even do a laparoscopy. So both are like imaging that we can actually do if we're trying to diagnose pelvic inflammatory disease. Okay, medical treatment: rest and warm compresses, sitz bath, analgesics to address the pain, and broad spectrum antibiotics can help. PID is an ascending infection. Like I said, it starts outside, maybe from the urinary meatus and then all the way up to the the vaginal canal, and then next thing you know, you're gonna have like a pelvic inflammatory disease. PID is a major female reproductive health problem and a major cause of infertility in the United States. The risk of getting PID increases as the number of sexual partners increase. In some cases, the PID is actually only discovered during like pregnancy, I mean surgery, or um, for like pregnancy, or like a blocked fallopian tubes when we're trying to like assess those kind of disorders, or ovarian abscess or other pelvic disorders. Okay. Endometriosis. And this one happens when, if you recall the um, introduction of the female reproductive, we were talking about those layers of the uterus. So one of them is the endometrium, right? The inside lining of the uterus. And this is actually the one that thickens and goes through like changes every month whenever we have that menstruation. So what happened with endometriosis is that those tissues in the that look like in the endometrium of the uterus is actually implanted somewhere else, that is out of the uterus. It's not supposed to be in there. For example, maybe it's in the ovary, right? Or it's in the fallopian tubes, or even outside of those of that uterus lining. So the problem is that every month, when the woman actually goes through like a menstruation cycle, is that those tissues, even though they're not in the uterus, they're still acting and behaving the way that those endometrium is. So they're still going to shed, they're going to proliferate. So because of that, the patient is gonna have some kind of pain. They're gonna have this dysmenorrhea, they're gonna feel that pelvic heaviness and abnormal bleeding. Common complications of the endometriosis is that there will be like a constriction of pelvis structures because of those adhesions because of those tissues. Also, constriction of the bowel, ureters, or both may cause partial or complete obstruction within the affected structure, creating a medical emergency. How do we diagnose this? We do a laparoscopy. Okay, laparoscopy, the one that I showed you earlier on. If you look at figure 52.1 in page 1022, these are the common sites of endometriosis. Okay, common sites of endometriosis. All right, medical treatment. So we can give anti-inflammatory drugs to relieve the pain, like your NSAIDs. Okay, and also, or another thing is that we can give them some hormones, right? Gonadotropin releasing hormone agonists can actually help because it's causing the estrogen level to fall. And when that estrogen level is actually down, it's going to permit or make those endometriosis implants to shrink. Okay. All right, we have also some medication like your Lupron or your Zoladex and Cinerel can also help with this endometriosis. What is a cyst? This is a closed sac-like structure that is lined with epithelium and that contains fluid, semi-solid, or solid material. And it could be benign, right? Benign cyst or tumor or malignant tumor. Uterine fibroid tumors are benign and common. It is estimated that at least 25% of all women will develop fibroid tumors during their reproductive period. Exact cause is unknown, but it is widely believed that those fibroid tumors they form and they grow in response to the stimulation of estrogen, the hormone estrogen. Signs and symptoms, the patient is going to have some irregularities with the menstruation, menorrhagia that we did talk about earlier on, dysmenorrhea, and then there will be like a gradual enlargement of the lower abdomen. Complications because of this larger enlargement of the lower abdomen, there will be some compression of other structures in the abdomen. Medical diagnosis. First, we're gonna see it in the pelvic examination. Okay. Okay, medical treatment. What we can give the patient is the medication that we call Lupron. And this medication, what is it doing is it's making those tumors hopefully to shrink. Okay, if not, what we can do is to surgically remove those tumors. Cystocele and rectocele, when there is bulging of those structure that is not supposed to have those bulging, like the bladder for the cystocele and the rectum for the rectocele through the vaginal canal or vaginal wall, I'm sorry. That is what we call cystocele and rectocele. And what's causing this is the weakened pelvic floor muscles. So, what would be signs and symptoms? There will be a bowel and bladder problems, right? They're gonna have the lower back and pelvic discomfort, and they might have some recurrent bladder infection. Medical diagnosis and treatment, Kegel exercise, very helpful because this is a weakened pelvic floor muscles, and Kegel exercise actually helps with strengthening those pelvic muscles. We can also do hormone therapy. Apologies, I got cut off from the previous PowerPoint. So this is the cystocele and rectocele. Again, for the treatment, what we can do is we can actually have the, if it's really bad with the protrusion, then we can actually do some surgery. If it's very mild, then what we can do is the Kegel exercises and the hormone therapy or ERT to improve the tone and the vascularity of the supportive tissues. And then we can also use a what we call pessary, and this is helpful with the cystocele. It's a device that is inserted into the vagina to provide the support. Okay, so what's the difference? This is normal, right? This is the normal. The vagina is here, and the bladder is not, protruding or anything. It's normal. Okay. Now, cystocele, if you can look at this one, everything else up here is okay, kind of. And then in here, you're gonna see that the wall of the um, bladder is actually bulging or distended right here, right? We call it the drop bladder. And then in addition to that, the vagina wall is actually going to be compressed in here, right? So it's uncomfortable for the patient. But again, if it's mild and you would want to actually start educating and treating the patient, then you can actually tell them to do Kegel exercises. It would help them. Okay, now you have the rectocele. If you look, this is the rectum, and there's like a protruding um, rectum right here. The vaginal wall is right here. Although you could see that it's supposed to be here, right, directly here, and yet there's a rectum here, and then it goes to a prolapsing rectum. We called it rectocele. All right, and this is the pessary that I'm talking about earlier on. We call it girl horn pessary. Okay, and what you do is you actually insert it there in the vagina, from the vagina to the area right here by the cervix. What it does is kind of like pushing it up like that, so it helps with actually um, the retraining of those muscles over there. Uterine prolapse. Okay, the uterine prolapse is when there's a prolapse of the uterine. Okay, what are the cause and risk factors? Congenital or during birth, childbirth, the ligaments, fascia supporting structures become stretched and weak. That's the pathophysiology of the uterine prolapse. What are the signs and symptoms? There will be a dyspareunia, which is painful intercourse, backache, and a feeling of pelvic heaviness and pressure. Um, so complications, what we don't want is for the whole uterus to actually prolapse, right? You don't want that. It's very that's an emergency, okay? So that's a complication. And the medical diagnosis, we are going to go back to like visual inspection, right? Visual inspection, we can actually see it. Or pelvic examination, also we can do that. Medical treatment, if it's really like protruding, then we can actually remove the uterus itself, which is what we call a hysterectomy. Okay, then this pessary can actually, some of those mild disorders, this pessary can actually help. Or if it really is needed now, then we can do surgery, right? Nursing care, we just might want to make sure that we support the patient. Right, that is a uterine prolapse. If you see, the uterus should actually be up here, right? And then there should be like a vaginal wall, and then the bowel, like the rectum, and all those anus in here. But in here, the prolapse is actually, the uterine is actually prolapse. It's actually like out of place, right? So again, if you're looking at this and you remember the how the pessary look like, so what they can do is they can actually, if it's like a not so mild prolapse, it's like right here maybe. What we can do is we can use those pessaries and actually can like push it up and then keep it in place in there until it's stabilized. Retroversion and retroflexion, anteversion and anteflexion. So in page 1032, let's take a look at it. These are the type of the uterine displacement, meaning that the uterus is not placed where it should be, or it's not properly in place. Okay, so cause and risk factors, there will be a weakening and stretching of the supporting ligaments, trauma or tumors, PID, and then endometriosis. Signs and symptoms, most cases are asymptomatic. If there is a symptom, then they will have a low back pain. Complications is difficulty with conception. If you can see in that page, in page 1032, you can see the anteversion, anteflexion, retroflexion, retroversion, and retroversion with retroflexion. It's not that the placement of the uterus is actually not um, going to be helpful if the patient actually want to have a baby. Medical diagnosis and treatment. So if we do some of those imaging and we see that this is the positioning of the uterus, then we might need to do some kind of surgery. Okay, so nursing interventions or nursing care is the education of your patient, the importance of Kegel exercise, and maybe we can also use those pessary that we just did talk about, and then knee chest position for relief from backache. Okay, fistula. So what is fistula? There's like an abnormal passageway between the vagina and other pelvic organs. So vesicovaginal fistula is what we call it when the fistula is in between the vagina and the urinary bladder. It's called vesicovaginal. The urethrovaginal fistula is located between the urethra and the vaginal. Rectovaginal is located between the vagina and the rectum. Surgical correction is often needed, although some small fistulas. Breast cancer is when there's like a painless breast tissue thickening or lump when they're actually doing the palpation of the breast tissue. So, what are the cause and risk factors? There will be a family history of breast cancer. It's also common in Caucasians, alcoholic, overweight, menopause, or those who have no child before age 30. Prognosis is good if we find it in the early stage. That's just like any other cancer. But if we find it in the advanced, then the prognosis actually is could be bad. Signs and symptoms, again, like I said, there will be a lump um, with when they're doing the self-examination. And then we also have to make sure that we're looking for those dimpling of the skin, right? Nipple discharge, nipple or skin retraction, and edema, dilated blood vessels, ulceration, and hemorrhage. Those are like signs and symptoms. Complications, it could infiltrate like adjacent structures like the breast and the axilla tissue, right? It could actually infiltrate those structures that is next to the breast. Medical diagnosis. There's a routine screening methods for breast cancer. Um, Please know them. There's three of them in page 1034. Oh, sorry, four of them in 1034, the bullet points. And then medical treatment. So, medical treatment is actually depends on how advanced we got the breast cancer is already. Get cut off again. I'm so sorry about that. So medical treatment, let's go back to medical treatment from for the breast cancer is chemotherapy, hormone therapy, radiation therapy, biologic therapy, or a combination of this. All right, cervical cancer, where there's a cancer or tumors in the cervix, and the cause and risk factors is HPV, smoking, compromised immune system, and multiple sex partners. HPV is your human papilloma virus, and signs and symptoms. Um, Late already is a blood tinged vaginal discharge and menstrual irregularities, and bleeding after intercourse. Okay, complications again is the invasion of this cervical cancer into like adjacent structures, the ones that's next to it. And medical diagnosis, this one is we're going to start with the pap smear, right? Pap test first, and then it's going to reveal kind of like an abnormal cells. And then what we do is we're gonna do like further testing, like biopsy, maybe a tissue specimen, and that's when we're actually going to confirm the cervical cancer. Medical treatment again depends on when, um, like what is the stage of the tumor when we actually um, saw it or diagnosed it, right? We can do like treatment, like radiation, surgery, or chemotherapy, or even combination of those things. If not, another thing that we can do is actually surgery, right? Surgery, again, depending on the invasion of the or extent of the invasion of these cells. So what we can do is a radical hysterectomy, which is the removal of the uterus, fallopian tubes, upper third of the vagina, and usually the ovaries, or total pelvic exenteration, which is the removal of the uterus and the ovaries and the fallopian tubes. Ovarian cancer is cancer of the ovaries. So, what are the cause and risk factors? Risk factors are like family history, early menarche, or late menopause. So, what are the signs and symptoms of your ovarian cancer? In the early stages, there is no symptoms. It's like asymptomatic. If it actually goes to like a more advanced stage, then the patient can have abdominal pain and bloating, heavy feeling in the pelvis, unexplained and worsening back pain, GI tract symptoms such as your flatulence, and urinary tract complaints may be reported. Complications, just like any other cancer, if it actually spreads to like neighboring structures, then it could actually be a problem. Medical diagnosis is that, the pelvic and the rectal examination, and then maybe we can even order those imaging, and then we can see that there's like some tumors in the ovary. Blood may be drawn for a cancer antigen called 125 CA125 serum marker test, which, if elevated, may indicate ovarian epithelial cancer. Okay, medical treatment is oophorectomy, which is the um, removal of those ovaries. And sometimes also the patient might go for like a chemotherapy or radiation therapy or even surgery to actually, remove the tumors. All right. Nursing care is just the same thing as what we do for those patients that have cancer. Cancer of the vulva is the rarest but also the most visible of the cancers of the female reproductive system. Is because we can see the vulva, right? It's not an internal structure of the female genitalia, it's outside. So we can see it, we can easily see those tumors or growth that is actually in the vulva. Cause and risk factors is your HPV again, smoking, and other cancers. Signs and symptoms is itching, pain, and bleeding. And complications is the same thing as other cancers. Medical diagnosis is also based on the palpation and visualization of the vulva. And then the treatment is, if it's a localized lesion, then they can actually do like a conservative removal of the tissue itself, either by laser or maybe topical chemotherapy. Vaginal cancer is the cancer of the vagina, and some causes are your postmenopausal. Risk factors putting the patient at risk is STIs, smoking, HPV, and radiation therapy. And for signs and symptoms, there will be a burning sensation, vaginal discharge, foul odor, dyspareunia, spotting after intercourse, and vaginal bleeding. And I'm not going to go over this right here because we just did talk about the complications, diagnosis, and treatment and nursing care for those cancers. Okay. Infertility generally is defined as the inability to conceive within 1 year of regular unprotected sexual intercourse. Infertility is categorized as primary if the woman actually um, has never conceived, or if the man has never impregnated a woman. Risk factors. So timing of intercourse, production of healthy ovum, anatomically and physiologically correct, biochemical compatibility, endocrine system, malnutrition, obesity, smoking, drug, alcohol use, exposure to chemicals and radiations. And like we said, medical diagnosis, if they go and get checked and it's actually a 1 year of unprotected sexual intercourse and they're still unable to conceive, then that could be an indication of infertility. Medical treatment depends on the findings. So please look at page 1044 in table um, 52.5. So please highlight this table and know them. The cause of female infertility, and then what do we do, what medical treatment do we actually give for these patients. Okay, menopause is the cessation of menstruation, right? That marks the end of a woman's reproductive capacity. Okay, what are signs and symptoms of menopause? Well, like we said, there's not going to be any menstruation. However, in addition to that, the patient may have some kind of other symptoms like hot flashes, a warm feeling caused by dilation that affects the face, neck, and upper body. Okay, this is based on the hormonal imbalances, because remember, menopause is the stopping of those menstruation, stopping of those sex hormones that we did talk about earlier on. Any other common symptoms are vaginal dryness, insomnia, joint pain, headache, and nausea. Okay, medical treatment, so we give them the estrogen therapy. And then for nursing care, same thing. Oh, we'll talk about that. Oh, never mind. Nursing care actually focuses on, managing those menopausal symptoms, and then exploring also how the patient could be coping with this significant life change. Okay. All right. And here, question one: infection with which organism is thought to be the most commonly occurring sexually transmitted disease? The answer here is A, C, Trachomatis. And that is the summary of chapter 52.